Okay, after a brief discussion with Dr. Shuttleworth and Dr. Rendon, we've noticed that there's a small gap in information that'll become critical to understand how to eradicate H. pylori infection. Dr. Shuttleworth will be talking about the antibiotic and proton pump therapy for eradication, and then our pathologists will be discussing about the course of H. pylori infection in the gastric lumen and gastric epithelium. So I just want to talk very briefly, a couple of slides about the H. pylori infection itself. The H. pylori is let's see, I'm using the PowerPoint here. So H. pylori has a tail, which is a motile tail, is cilia, and so it's able to penetrate through that protective mucus layer that we talked about the gastric epithelium. Remember, this is pH 2 up here, this is pH 7 down here, and the motility of the H. pylori organism allows it to burrow through that mucus layer. The H. pylori also has an enzyme called mucinase, which is able to digest some of the mucus layer, which we'll see in a second becomes very important as part of the infection. The next step is that the H. pylori is, of course, in a very hostile environment because of all of these protons here. We have a lot of acid, of course, from the gastric pump, and so the H. pylori needs to perform a reaction to make this a more hospitable environment. So it has an enzyme called urease, and this enzyme is very unique to the H. pylori, and it's able to take urea, convert it into ammonia, and most important, this is the end result, is neutralize the gastric acid. Okay, so it performs this reaction. Then if you come down here to panel 3, you see that this particular area, this white zone, is like a protected zone. And notice the number of H. pylori is increasing rapidly. So once the environment is created to make it a hospitable environment, then the H. pylori can undergo replication and grow and colonize that particular area of the gastric epithelium. Now, through all of this, panel 4 here is the one that shows you really what's going on. So we have the H. pylori creating this environment for itself. But it's also, because it's a bacteria, it's producing cytotoxins, and these cytotoxins are affecting the epithelial cells themselves. And then once the epithelial cell becomes compromised, then we start getting mucosal damage, primarily because these epithelial cells are no longer able to secrete the bicarb and the mucins that are necessary to protect that epithelial layer. So the colonization of these H. pylori are disrupting this normal function, and now this opens up the possibility of the pepsin, which is the protease, primary protease that's involved in protein digestion, acid dependent, and the acid itself from contacting that epithelial surface. That, of course, is going to cause mucosal cell death. And that is going to trigger an immune response. And so we'll have a large amount of superficial gastritis, superficial inflammation in this particular area. And this is how we get erosions and eventually H. pylori driven ulcerations on here. Now, let's take a look quickly at this urease chemical reaction. So here's the chemistry. Here's our urea. This is our urea molecule here. Notice the nitrogen's on here. That's why it's going to become an important part of this reaction. We're going to add a couple of waters here, but most importantly, look at this proton. This is the protons coming from the acid environment in the stomach lumen from the potassium proton ATPase transporter. And here's that unique enzyme that H. pylori expresses, the urease enzyme. And that is going to take these protons and combine them with water and hydrolyze these particular bonds here and here, combine the proton with this, and then here is our neutralized form of ammonium ion. So this has undergone the neutralization of the acid, and importantly, we're going to have bicarb released. Now, this particular reaction, it's been taken advantage of for generating laboratory tests that can be done very quickly and very easily to determine H. pylori infection. And that is called the urease breath test. So this is how this works. So here is our urea molecule right here. This is taken in capsule form and pill form by a patient. Notice that the C here has 14 written on it. This is radioactive carbon 14 in the urea molecule itself. Now the other one that can be used is carbon 13. In carbon 13, this is a stable isotope. It is different than normal carbon 12, so it can be detected properly. But carbon 14, the radioactive epitope, is the easiest to generate and easiest to detect on here. So this urea is taken up as a pill form, it's swallowed, it's into the stomach, and if urease is present, because we do not have this enzyme, if it is present, this H. pylori will generate the ammonium ion, which is the part of the neutralization of the acid, and it will also evolve carbon dioxide. So the bicarb enters the circulation and then gets to the lung, and then of course it's converted by carbonic anhydrase back to CO2, and it appears in the breath. So this particular reaction only takes about 10-15 minutes in a laboratory setting, and a patient will take the urea, go through this process, and then about 10 minutes later or something will breathe into a bag. Usually this is not a flask, but it's a bag that they breathe into with a one-way valve. And then this, the C14 that is present on the urea now would be converted into CO2, and then this is counted, the radiation, to determine if the C14 is present as CO2. If it is not present, that means that the urease enzyme is not in the stomach, which means that there is no H. pylori infection. If it is present, that means that these reactions will occur, generating the bicarbonate, and then we'll have this evolved through the lungs as CO2, radioactive CO2, and then this will become detectable when we count it.